How do you get someone to wear a mask? The question is back on many people's minds as cases of the Delta variant rise among unvaccinated and vaccinated people and pressures mount to mask up. Despite mask mandates, social pressure and even rewards, giving gift cards to kids who wear their masks properly, for example, the country remains divided on mask wearing. President Biden condemned anti-masking behavior at a press conference Thursday at the White House. But some countries have been making progress in getting people to mask up. Researchers from Stanford, Yale, the Bangladeshi non-profit GreenVoice and the research group Innovations for Poverty Action, among others, are conducting an ongoing study in 600 villages in Bangladesh to figure out the most effective behavior-changing techniques, with the goal of sharing them across the globe. The researchers say these methods could be especially helpful in reducing COVID-19 transmission in low-income countries where the supply of vaccines is limited. While the measures may not work in every country, there may be helpful takeaways, including for countries such as the US, where masking has become politicized. Mushfiq Mobarak, a professor of economics at Yale University, says the experiment was inspired by a concerning observation he made early in the pandemic. While working in his native Bangladesh in May 2020, he noticed that despite government masking mandates and fines for the unmasked, no one around him was wearing a face covering. Mobarak was alarmed. Masks are the best chance for Bangladeshis to stop the spread of the coronavirus. Bangladesh is one of the most densely populated countries in the world, making it nearly impossible to distance in public spaces. And a weak healthcare system means that people sick with COVID-19 may not immediately get the treatment they need, says Lawrence Gostin, professor of global health law at Georgetown University, who was not involved in the research. So Mobarak set out on a quest to find out how to get Bangladeshis to wear masks. Mobarak and a group of researchers teamed up with the Bangladesh Medical Research Council and the Ministry of Health and Family Welfare to design and conduct a program that would evaluate different strategies to increase mask wearing. They'd do this by testing it out in the real world, with 341,830 people in 600 villages, some in rural parts of Bangladesh and some just outside big cities. The experiment rolled out in waves from November to January. The researchers randomly chose 300 villages to receive mask interventions for 8 weeks. Another 300 villages received no intervention at all. They'd be the comparison group. People who lived in the 300 intervention villages were subjected to a set of core practices during the testing period, inspired by the best ideas in social, economics, psychology, marketing literature, Mobarak says. The strategies essentially centered on free face coverings and reminders.